Hello, and welcome back to my channel. Today, we are going to try something new. I am going to react to a video. I chanced on this video on TikTok, and it's this pretty lady sharing her sister's experience on how she was being treated when she was in a hospital, trying to receive treatment for a terminal illness. And I feel like it's actually something that has been going on. Many Black people have been, considered rude and combative, especially when they are trying to advocate themselves in medical settings. So I saw this to be a really interesting video, and I decided to, share with you and hear your thoughts as well. I'm gonna share my thoughts as well. So let's get into it.
So I come across this tweet where this white MD is talking about how social workers, nurses, therapists
Oh wait, pause. Let's pause. Yeah. So white MD, that's a white medical doctor, but I need to read this tweet before we can, go into it. So it says, just thought I should let people know if you are rude to a nurse, social worker, therapist, etc., they document what you said or did in the chat, and your physician reads it. Mm. Um. Okay. Okay. Fine. Okay. Fine. Yeah. People. Yeah. Yeah. Physicians read it. That's true, and it's stuck in your chat for life. It's just gonna be with you for life. So let's just, I can't really say much about this tweet right now, but let's just listen to her story and then we can know what to say about this afterwards.
can write down rude behavior for a physician to see it. And my mutual Imani brings up a good point of how Black people are typically seen as rude and combative in medical settings. And I figured I'm going to take this time to tell a story, but not my story, my older sister's story.
Tell us, love. Let's know.
So my older sister was denied from the heart transplant list twice. 27-year-old Black woman with 2 kids, denied twice.
Wait, did I just hear she was denied heart transplant twice? For what reason? Please. I want to continue playing the video, but whilst I'm listening, like whilst I'll be listening to the video, I want to hear like tangible reasons why she was denied heart transplant twice. Like these transplantation stuff, there are a lot of rules that are governing it. Okay. So for you to be denied, it should be something really tangible. Maybe they found something in your system that doesn't qualify you to receive the heart, transplant. Or maybe I don't know. But it could be several reasons why you should be denied. But I just hope it's tangible enough. Let's just get into it.
Due to non-compliance. Now, the non-compliance in question included not always liking to eat that nasty-ass hospital food, missing medication because nurses would forget to wake her up, and then having anxiety panic attacks that were deemed as aggressive and rude to staff.
Oh, wait, wait. So these are the reasons why she was denied. Why? Wait. So if I heard her right, she didn't want to eat the hospital food because she didn't fancy it. So fine. Number two, what? She missed her medication because nurses forgot to wake her up. And number three, she was deemed as rude because she was having anxiety attacks. Okay, I've never seen anywhere that these are part of action, like the criteria to eliminate someone from not getting a heart transplant. But I guess I would have to look more into it and see if I can find these reasons because to me, these reasons are not tangible enough. Why? Why? I don't want the food. Yes, that's my own choice. I don't want it because I just don't fancy it. Fine. Yes, I can get my it's not like I'm not eating. I'm eating, but I'm getting my food from somewhere else. I can get my food from the cafeteria or can I can ask my family members to bring me food from home. Number two, nurses are not waking me up because what I'm taking a nap or because sometimes people are in pain and then when they sleep the pain goes down like they are trying to relax. Obviously, yeah, you're in the hospital, you have to relax. Why should nurses forget to wake me up? Medications have, some certain, like some specific drugs or medications have specific times to be taken. Okay, so why wouldn't you wake me and why would you forget to wake me up? Is it like No, this doesn't make sense. And the third one, because what I'm going through, like what stuff, and I'm having anxiety attacks. I said I'm gonna look into this and see if these are not part of the criteria, then this lady wasn't treated like fairly, seriously.
She died about 2 months after she was denied the second time on the transplant list. It's been 7 years since that she passed, and it is still ingrained in my head.
I'm really sorry for your loss. Yeah, but it is what it is. This is so bad. So embarrassing to hear.
How our healthcare system can so easily masculinize and villainize Black women who need care. So
Thank you. That's yeah, exactly. Exactly. That is what has been going on. Black people, not even black people, let's black women they are being masculinized, and this doesn't make sense. It doesn't make sense at all. Like, why would you just look at the skin color of someone and see how tough their skin or their skin look and just assume that they are able to take anything? This this is so bad because obviously, yeah, we are the same. We are not built differently. Okay. All the pain receptors that are put in people, like let's say the pain receptors that are put in white people are the same pain receptors that are found in black people. So you don't assume that we are able to like take things differently. It's not done that way, please.
let's just start all the way in the beginning. My sister had postpartum cardiomyopathy, which is a heart condition after her first pregnancy.
Okay, let's break that down. Postpartum cardiomyopathy. So that she had it after she gave birth. She had a heart problem after she gave birth. Okay, fine.
Which took a little minute to diagnose because the doctors dismissed it as asthma for a year, and by the time that they diagnosed her, she was already in full blown heart failure.
Wait, I don't understand the relationship between asthma and postpartum cardiomyopathy. I think I have to look into that. Do the symptoms like do they overlay each other or something? Because how can you miss such a diagnosis for asthma? I don't understand. And besides, we are in an advanced world now that things are made easily, like in easy ways. Asthma would definitely present with different, like different symptoms. Obviously, if it's even a symptom, if asthma is a symptom of that cardiomyopathy that this lady had, that is like an underlying cause, but that is not the main issue that's going on. Okay, so why would you miss? Oh my god.
So, for 5 years off and on, managing heart failure from around the ages of 22 to 27, 28, in and
Very young lady, 22 to 27. So she had a late diagnosis for like what, 5 years? So for that period, she was being diagnosed of what? Asthma for 5 years. So that was after 5 years. That's when they found out that it was what? A cardiac issue, heart problem. Lord have mercy.
out of hospitals, having two kids, trying to go to school. You can only imagine what that could do to mental health, right? So, yes, every now and then she would freak out.
Exactly. Exactly. Even if it were me, I would freak out as well. Because basically, number one, I've had a late diagnosis. Number two, this whole thing has affected my mental health. Number three, you have kids at home and you're always thinking about them. You're being stuck in the hospital. Who is taking care of my kids? Like, obviously, yeah, you have family around, but there's no other love than the mother love, especially when you're still alive.
She'd freak out in the hospital. She'd want to go home. She'd want to pull things out. She'd want to go home to her kids and just get the fuck out of there. Now, I would think,
I know, I understand. Maybe she started saying it quietly and in a calm way. Okay, like maybe I want to go home. I don't want to stay here. Okay, I want to see my kids. Like she was saying it in a quiet, like in a calm manner. But maybe nobody listened to her about it. So she decided to take things into her own hands by trying to pull stuff out, like taking off the drip, taking off cannulas, taking off the ECG pads and all the stuff. But yeah, I understand this can be seen as like an aggressive way. But yeah. It's something that's actually going on. It has affected her mental health because understand, she's gone through a lot. That was too much.
A whole bunch of healthcare professionals in a healthcare professional setting would be able to see a Black woman with a terminal illness having an anxiety attack. But no, that was often written down as aggressive noncompliance. One time, me and our dad were in the hospital room with her, and she was in such a great mood, which by this point in time was very rare. Laughing, having a good time. The social worker comes in and starts berating her about her supposed mood, berates her about missing medication that morning, even though my sister told her that the only reason she missed it was because she was sleeping and the nurses forgot to wake her up. And after this back and forth for around 10 minutes, the social worker decides that that's when she wants to say, oh, they're also concerned that you're a bit depressed. They're concerned about your mental health. And at this point, my
Wait. So these social workers, like, who actually assign them to patients? Because I believe if someone is your social worker, the person should be able to understand you and know what's actually going on with you, and not be someone who would be against you, I would say. Because why would you come and, yeah, obviously, as she said, at that time she was in a good mood because the family was around, she was laughing, she was, having a good time. And then you come in and you start asking her stuff that, okay, fine. So I've heard you missed your medication. So yeah, you've documented that she missed her medication. You documented it as if she deliberately missed it. And she told you no, she was asleep and the nurses forgot to wake her up. So I believe that there are ways that you actually have to address this kind of issue, okay? But I don't know how they went by with this. And then since you thought that, well, she had a point there, you decided to bring in another thing that was going to shatter her. That I've heard you've also been depressed. Please, you should know the person. If you're a social worker, you should know the history of the patient so you understand some things that these patients are going through. You understand? She had a late diagnosis. She's been going through a lot. So obviously, yeah, she's been depressed. Yeah, so depression, yeah, she's been depressed. This shouldn't be a bad thing that's supposed to go into her records. It's not as if she did something bad and it got her depressed or something. Please.
sister's spirit and energy is completely ruined and drained. She's numb. She can no longer answer. And that's when my dad steps in and says, you calculated that. You came in here when we were having such a great, wonderful mood, started bringing up all these negative things, not listening to what she was saying, beat her down, and then wanted to have a discussion about her mental health and talk about how she's seemingly depressed.
Bad vibes, bad energy. The only time she was so happy because what her father was around, her siblings were around, they were trying to have a good time. That is when you come up with the bad vibes. That is when you're trying to ruin her mood the more. Please, I beg, we don't want any bad energy around us, okay? You should have even seen that as a positive thing that, oh, this patient has been really down, like, but while seeing her family around, it has actually uplifted her mood. You shouldn't come in. Healthcare workers, we should know when, the settings, okay? You should know the appropriate time to go to patient with such information or such stuff. Because obviously, oh, please. This is where empathy comes in, okay? Just try to put your person in, like, sorry, try to put yourself in the person's shoes, okay? If it were you, you wouldn't want to receive that questioning or that information at that time. Let them have that good time. Later, you can come around with whatever you want to ask me. That's going to put my mood down.
Social worker left, me and my sister started bawling in infuriation and in tears. And she's telling us, this is how it feels to be here all the time. This is how I feel I'm being treated. Throughout the 5 years for management, my sister would often use marijuana to help with her pain management and her appetite, which her doctor confirmed and knew she was doing. Wanna know
Okay. Okay. So I think she was in so much pain because for her to use marijuana, that means the pain was, at the highest peak. And she said the doctors confirmed, so the doctors knew. So what happened? If the doctors knew, that means it was documented somewhere. I'm sure. Because yeah, doctors do great job. Mm.
one of the other reasons she was denied from the heart transplant list twice? Small traces of marijuana in her system. And
Wasn't it documented anywhere that the doctors knew that she was on marijuana? Marijuana. I don't even know how to pronounce it. wasn't it documented? It should be, and then the reason why she was on should be documented as well. So this actually feels so bad. Like,
Again, after the second time she got denied, she died around 2 months later because her body was already failing. She had already had multiple near-death experiences, passing out where her heart stopped. She had to get a defibrillator because it was happening so often. It was affecting her schoolwork, where she had to stop going to school. She couldn't be home to take care of her kids and be with her husband. Not only was she fighting a terminal illness, she was also fighting a system that was hell-bent on villainizing her at every step of the way.
so now we see and we know where this anxiety and depression actually came from. So she was just going through a lot. She was dealing with a whole of things. She had to drop out of school. She had to battle this terminal illness. She had to, she was thinking about her kids. She knew that she would, even at the place where she was at that moment, in the hospital where she thought that she was going to be okay, she was being what? Treated bad because what? You know, this is the main reason why people have started losing trust in healthcare professionals, because obviously, if you come to the hospital and you're being treated this way, how do you expect your patients to trust you?
If I'm being quite the fuck honest, rudeness from people who are dealing with terminal illnesses, how are we really quantifying that? Because if black people who work in the healthcare system can deal with old fucking racist white people saying slurs to them and they still gotta give them care.
Relax, relax, relax. I know, yeah, this is really painful, but yeah, just chill, okay? Because yeah, yeah. I just don't know what to say about this. Seriously, I don't know what to say about this. But I know I feel your pain. I feel your pain. I know sometimes some white people actually behave worse than how your sister even behaved, but they are not seen as rude. That is the thing. They are not seen as rude. But yeah, it is what it is, isn't it? It's just where we find ourselves to be.
I'm kind of not inclined to understand how rudeness can be equated or conflated with abuse. And that could go to a whole other video, maybe from someone who has a little more expertise in this exact field than I do. But I say all to say because my sister can't tell her story. She's no longer here to do so. And I typically don't go into the specific nitty-gritty details because every time I do and I think about these memories that I have about how there was clearly some fucking medical negligence, I get enraged. Rage is a good thing. Rage is amazing.
Okay, so now she's just talking about her own personal feelings and stuff. But yeah, I don't know what you think about this whole issue. But yeah, for me, it is something that's been going on and it has to be stopped. It has to be stopped. I think it's about time medical professionals actually understood that black people are also human. We are not built differently. We are, the same species as themselves, and they should treat us equally as how they treat other patients. I'm not talking down on anyone, but I'm just saying that I feel like health professionals should do better when it comes to these kind of things. Um, just don't see anyone as different as they are not. Okay. But yeah, I'm so sorry for your loss, love. But thank you so much for sharing your story, your sister's story. As you said, she's not here to tell her own story. And I know there are a lot of videos out there with people complaining, with people. I think I saw one video one time. It was a black lady saying that she'd always prefer a black doctor to look after her whenever she goes to the hospital, and she has her own reasons why. Okay, she understands why she's saying that. But yeah, please, as now how the system is, there are not a lot of doctors around. It's just, let's try and treat everyone equally. Let's just stop these kind of things. They are not helping us. They're not helping the society. They're not helping people to heal. All right. So yeah, we've come to the end of today's video. Thank you so much for joining me in this reaction video, and I am just hoping that I'll be able to come back to react to more videos. Okay, because I feel like there are some things that we have to address, and don't also forget to put your experience in the comment section below. Let us know, tell us about your story, and then let's find ways and means to try and advise ourselves. And please do not be so raged, do not be so angry at the medical system. We are trying our best, and trust me, it's just a whole lot that's going on. But yeah, just stay safe, okay? And then I'll catch you up in the next video. Bye.